and welcome to SureenaSpeaks, and in this video it features who I consider as the queen of community pharmacy. It is Reena Barai. Now Reena has a wealth of experience as a community pharmacist, and in this video she not only shares those experiences, she also gives us an insight into all the other roles that she's involved in and gives us a first-hand account of what it's been like as a community pharmacist on the front line during this pandemic. Now I do go a little bit fangirly on her, so apologies for that, but I hope that you do like this video, and if you do, why not give it a thumbs up, share, like, subscribe. Do also visit my Facebook, Instagram and Twitter. But now it's time to sit back, relax and listen up. Hi Reena, it's so good to see you. Thank you so much for being here today. How are you?
I'm very good, thank you, Serena. Thanks for inviting me. I'm really excited to talk to you today.
Same. It's been a while since we've been able to catch up and everything, and this is the new normal, as everyone's calling it now, thanks to Zoom. But before we go any further, and there is so much that I want to talk to you about today, do you mind just briefly introducing yourself to my viewers, please?
Okay, my name is Reena. I am a community pharmacist. I have a pharmacy in Sutton in Surrey. And I've been a pharmacist for over 20 years now, actually, which seems really scary. And I've done many different things, which I'm sure you're going to ask me about, so I look forward to sharing those with you.
No, thank you so much. Now, the one question that I like to ask any pharmacist that I meet is, why pharmacy? What was the inspiration behind going into pharmacy?
So for me, that's a really easy answer. My dad was a pharmacist. And basically my family bought the pharmacy that I now run when I was 1. So I used to live upstairs in the flat above the pharmacy and never wanted to be upstairs, always wanted to be downstairs talking to the patients. And you know, I learned from a very early age how to price products with a pricing gun and putting tops on bottles in the pharmacy at the back. And I knew, apparently my first word was prescription. That's what my dad always used to say to me. So I think I knew from a very early age that I wanted to be a pharmacist, and I think I'm quite lucky because a lot of people don't know what they want to do. And so so it's quite hard for people, isn't it? Because if you don't know, you can go through school life you know, feeling a little bit lost, whereas for me I was really determined. I always knew that I wanted to be a pharmacist.
And I guess pharmacy was in your blood almost as well.
Yeah, absolutely. Second generation, so it's quite nice actually to continue that tradition and the business as well.
Exactly. It's funny you mentioned the price gun, because I remember when I did like work experience in high school, and I did work experience in a pharmacy. It was the first time I was working in a pharmacy. They gave me the price gun to go around, and it was just the best fun.
I know, it's so fun, right?
Like I could do this for a living. This is amazing.
Yeah, it's really good fun. And I still, even now when I do it, it just reminds me of childhood, and just I used to price myself and see how expensive I could make myself.
You're priceless, that's what. Now, if I'm honest, whenever I think of community pharmacy, I do think of you, Reena, because I think you're an advocate and champion for community pharmacy, and you're so passionate about it as well. And I know in your Twitter bio, you call yourself a self-proclaimed cheerleader for pharmacy, and having followed you on Twitter for years, like I can fully vouch for that. I can see the passion in you with community pharmacy. So in your opinion, do you think community pharmacy, and particularly the role of a pharmacist, has changed from when you first started pharmacy to what it is today?
Absolutely. So if I think back to like what my dad used to do in the pharmacy and the sort of services that we offered back then, and it was very much around selling of products actually, not necessarily pharmaceutical products too. We had a big sort of perfumery range, and the you know, the photo processing and all these sort of things that we used to do that was kind of like a, you know, part of a chemist's shop, wasn't it really? And now if we think about the way pharmacists are perceived, I think we are seen so much more as a healthcare professional on the high street, aren't we really? It's not just about that chemist shop anymore. People coming in all the time for advice, which used to happen, you know, back in the day too. But I feel like now the NHS has almost recognised that part of our role as well, more compared to what it used to be like, you know, in days gone by. But also for me, I started my career as a hospital pharmacist, and I've worked in lots of different fields in pharmacy as well. And actually, I'm quite pleased that you think I'm quite a good advocate for community pharmacy, because that's exactly what I want to be. There aren't enough of us that shout about how great community pharmacy is. And you know, when it's done properly and it's done well, and you care about your community, and there are so many examples of people who are like that, you know, it's hard not to be passionate about it, because it's such a brilliant sector to be working in.
I agree, and I think that rapport and that relationship that you can build with your patients is probably one of the most unique and special things with pharmacy, and it's probably something that is quite unique to community pharmacy as well, especially when you've been working in a place for X amount of years and you know your patients inside out, you know their families, you know their stories. They probably share things with you that they don't actually share with close friends, for example. It's very, very special. And I mean, on a personal level, because I started in community pharmacy as well, that for me was the key thing which I loved about it, was that relationship, really.
Yeah, and I never go to work feeling like it's a chore. You know, going to work, opening my pharmacy every day, it just feels like an absolute pleasure to serve that community, because they've known me since I was a baby. So many of them have been using my pharmacy, and you know, it's so lovely when they come in and say, "Oh, I remember you when you were this high, and you know, your curly little hair, and you know, this little girl that was giggling all the time in the pharmacy." And it's just so nice to be able to help these people who've supported my family and my business for all these years, and to sort of, you know, bring that back and sort of help them if they've got older and have more medical needs, etc. It's just an absolute pleasure to be able to do that.
Yeah, and what I always say with sort of any job role that you go into is, especially if you're working full time, you probably spend more time at work contacting and connecting with your colleagues, even if you're not in an office environment or you're not in a community environment, wherever it may be, you're at work with those colleagues and with patients more than you are with, say, your friends, your families, your pets, with anybody else. So you have to be enjoying what you're doing, because you're essentially spending more of your life at work than you are anywhere else. And if you're not enjoying that and you're not getting that fulfillment, then I guess you really have to question what role it is that you then do want to go into.
Absolutely, and if you're not enjoying it, it's quite interesting how that rubs off on the people around you. So in pharmacy, especially community pharmacy, they're quite small teams. And we've all gone into work somewhere, you know, whenever you've locummed or whatever in the past, where you can just see the pharmacist doesn't enjoy what they're doing, the team don't enjoy what they're doing, and it's such a negative, awful atmosphere, isn't it? And so I think I always say to myself, I'm not allowed a bad day. Especially when I'm on, you know, when I go into work, even if I feel like I don't want to have a good day, I always switch myself off from that, because it's so important to stay positive and to you know, to be that sort of role model for your team so that they feel positive about what they're doing. I always say to my staff, I would hate it if any of them hated what they were doing. If any of them sort of dreaded coming into work. And that's the one question I asked them during my appraisal for you in the last year. Ever felt like you don't want to come into work? And you know, luckily they all say no. And I just think, thank God, because that's exactly what I want you to do. I want you to come to work and enjoy it and look forward to it. That's, like you said, the biggest part of our life, isn't it?
No, definitely. So for anyone who's thinking about going into community pharmacy, what advice would you have for them, and what skill set do you think they need?
So I think community pharmacy is, I think to be a community pharmacist, you have to almost be a jack of all trades, don't you? Because you never know what's going to walk through that door, do you? What sort of queries you're going to get when you answer the phone, or you serve a patient, or you're doing a prescription. So I think there are some real core skills. One of the most important ones is communication skills and those consultation skills. I get a lot of pharmacy students coming into my pharmacy because we're affiliated with Kingston Uni. So we get their students coming through. And one of the things I always teach them as well is to, you know, don't just concentrate on the one task. Because when you're a responsible pharmacist, you're responsible for everything that's going on in the pharmacy. So one of the things I always tell them is learn to listen to everything that's going on around you, as well as concentrating on the tasks you're doing. And that's the multitasking part of being a community pharmacist, isn't it? We all remember that. You're answering the phone, you're checking a basket, you're, you know, serving a patient, you're doing all these sorts of things.
So true.
So it's the multitasking, the communication skills, there's consultation skills with patients, and just how to stay calm under pressure. And I think those sort of soft skills are really, really essential. They're the sort of things we never got taught at uni, did we? And you develop them through watching people when you've worked in places where people have worked really well, or you've worked with people who maybe don't have those skills and think, gosh, I don't want to do like them. You know, and you pick up those skills as you go along, I think. And those are probably the attributes I think people would need to work on. And I always get work experience as well. it's such a good thing to be able to get some sort of work experience under your belt, so that you can decide if that is a sort of career or sector you'd like to work in as well, if you're thinking about doing pharmacy.
No, exactly. And going back to what you were saying about sort of learning from watching other people as well, I mean, I fully agree with that, because I've worked with other pharmacists and other pharmacy teams, even as a student, and it is that thing of, you can pick out attributes and qualities that you think work really well, and then you can pick out those attributes that you think, oh, actually, that doesn't work that well. I'm not going to do that when I'm, you know, a responsible pharmacist and such like. And there's a lot you can learn from just observing, really, as well.
Absolutely. And I'm going to use a Pokemon quote. I've got two boys who are really into Pokemon. But Pokemon's all about evolving to be the better version of yourself, or the better Pokemon. So I always think, actually, as a healthcare professional, you should always strive to evolve to be the better version of yourself. And you can only do that by seeing others and learning the good things from others, or, you know, not doing those bad things from others, maybe, that you kind of notice. And that's something that I've really enjoyed in my career, definitely.
I think that's a really good way to put it as well. And I guess, speaking of evolving, we can't really talk about community pharmacy without talking about this crazy world that we've been in right now, which is this COVID, coronavirus, pandemic. And, you know, for anyone who isn't aware of the role that community pharmacy has played in this pandemic that we've been in, as someone who has been on the front line right from the beginning, can you provide us with insight into what that's actually been like for you as a pharmacist and for your team working in a pandemic?
So it's beyond any of our expectations, what happened and what's been happening, actually. And to be honest, it's been really quite amazing at how resilient we've been. I think if we stop to think about what we've dealt with, you're going to cry, to be honest, because it's been quite exhausting. You know, we've lost patients. We've, you know, people who are really dear to us, and that's been a really sad part of it. But actually, what I'm really proud of is that we stayed open and we stayed safe. My team have been safe, we've been safe. We have supported our community, we've looked after us all these years. It's been nice to be able to give them something back. We saw a massive increase in demand of people walking through our pharmacy, a massive increase in telephone calls to the pharmacy, big increases in dispensing prescriptions. We saw you know, a doubling or tripling some months of our delivery service out to patients. We saw lots of people coming into pharmacy for advice because they couldn't go anywhere else. And it wasn't just for those little minor ailments, it was for injuries that people were doing when they were at home, or minor illnesses like, you know, wound infections and things like that, where they were struggling to get access to, you know, GP, which they would have maybe easily been able to do before COVID. So, you know, that demand that we've seen has been incredible. But at the same time, my team have dealt with it incredibly well. I think we stayed calm. We kept on top of all the information that was coming out so that we could stay safe, you know, wearing our PPE, protecting ourselves with plastic screens, constantly cleaning our hands, keeping our distance from patients. All of those things that we put into place quite early on helped my team and I just to feel safe staying open, and helped us to support our patients as well. Yeah, one day we'll look back and think, gosh, how did we do it? But at the moment, I feel, you know, I feel really proud of the way we've dealt with all of this. It's been really, really incredible. And I've got this lovely wall in my pharmacy where we stuck all these thank you cards that people have been sending us. And every day we go and read those, because it's just the nicest thing that people have really appreciated how we've gone above and beyond. And you know, that's what we're there for. We just want to go to bed at night thinking, you know what, I've done a good job. And that's definitely how we all feel as a team.
That's amazing. I mean, I have such I'm like such a fangirl of yours, but I such admiration for you. And I think more than anything is your attitude towards it all. You're so positive in a time which I think can be really, and I'm sure you've had like really challenging moments, mentally, physically exhausted, and yet you're still smiling. And again, I've seen it even on Twitter when you're still spurring people on, still motivating them on. And I think that it just shows what an amazing inspiration you are, but also role model that you are to community pharmacy as a whole. And, you know, just thank you for all the work that you and your team have done during this pandemic.
It's so interesting, because I don't see myself like that at all. And that's the imposter syndrome that kind of creeps in, doesn't it, to all of us. I don't see myself like that at all. I am just me doing the job I love, and And actually, yes, I've had very down days. There's been times where I've even felt like selling my pharmacy, thinking, why am I doing this? Surely there's a better way to earn a living and to, you know, to live life. But at the end of the day, I think you've got to have that right balance, don't you, in life? And so another one of my kind of big mottos is work hard, play hard, and be kind. So, you know, as much as you work hard, make sure you play hard, and making sure you have those enjoyment, you know, that enjoyment outside of work as well, so that you can stay positive in work. All of those things are so important. But thank you. Yeah, I really don't see myself like that, but yeah, that's really nice.
You know, I'm sure I'm not the only one that sees you in that light, genuinely. And I mean, you say work hard, but it's not just community pharmacy that you do. You have so many different roles that you're involved in. I mean, you're an NPA board member, you're on the RPS committee. I know you've previously had roles in as a CPDE pharmacy tutor. Firstly, how do you have time for roles? But secondly, for anyone who wants to go into these different types of roles, again, what advice would you have for them?
Okay, so I think very early on, I found I get bored, and I want to learn more. I'm really hungry all the time to learn more. I don't know what it is about me. I don't know why that I have that kind of trait in me. And for me, I started off my career as a hospital pharmacist. Absolutely loved it. Really, really enjoyed rising up the ladder in hospital, doing my diploma and learning all the different clinical specialities. And then I took over my pharmacy in 2003. And while I was enjoying it, I saw these new roles emerging in primary care trust, which was back then, which is the old CCG. And I realized what I could do is do some work in my pharmacy, but spend a couple of days a week doing something different to broaden my horizons. And again, it comes back to that Pokemon thing, doesn't it? Evolving to be the better version of yourself, and also wanting to learn from others. So I started off doing a couple of days a week as a practice support pharmacist and working for the PCT. I did that for a bit, and then I had a bit of a career break for my kids. And then the CPPE role was really interesting. I saw an advert. So I went on a training course actually to PPE, and somebody came up to me saying, "Oh, you'd make a great tutor." And I thought, me, a tutor? I've never thought to do that. And she said, "Oh, why don't you apply? There's a job." And I thought, do you know what? I haven't been interviewed in like 10 years. I haven't applied for a job in 10 years of my life. Let me just do it for a joke. You know, a bit of a
You can do it.
Yeah, so I literally did that because I thought, do you know what? I haven't written my CV in so many years. I haven't been interviewed, and it was a tough interview process, the whole day of interviewing and presentations, and I absolutely loved it. And then I got the job. I was really shocked. I thought, oh gosh, I did this for a joke. I didn't mean to actually get the job. So then I actually had to do the job and loved it. So I've always been one of these people that kind of wants to spread my wings, and I think I love pharmacy so much that I wanted to understand all the different parts of pharmacy. So I worked in primary care, GP land. I became a GP pharmacist for a couple of days a week as well last year, and the hospital role. So now, if anybody talks about pharmacy, I can picture and relate to so many different aspects of it. And actually, that's made me such a better community pharmacist, because now if I'm talking to a patient, I know what happens at GP end. I know what happens at the hospital end. So when I'm trying to sort out a patient who's been discharged from hospital and the prescription's a bit wrong because the GP hasn't read the discharge properly, or I can understand all the different phases and all the different bits that go wrong, and it just helps me to help patients. Definitely. And so I think that's one of the things that I've really kind of relished in my career, and I am super organised. People really think I'm a bit anal, but I have my life timetables. I wake up in the morning and I check my diary and see what am I doing, and I have to be organised because I've got my finger in so many different pies that I would hate to drop any of the balls, but it does happen sometimes. The juggling act is tough, and sometimes I do forget to go to a meeting or something like that. But for me, I've got a lot of energy to give right now, and while I've got it, I want to give it to pharmacy. So that has been kind of my way of looking at it over the last few years of trying to push myself. And this person you see is not the person who qualified as a pharmacist, that you may look at me as a role model and confident and whatever, but I was never that person. I was always too scared to say boo to a goose. Can't imagine now that I sit at a board and happily raise my voice and say things and raise my hand. But it's really interesting how, like I said, that evolving process has made me grow in that confidence and learning to use your voice as well. Those communication skills, those being able to understand pharmacy, so you can talk about pharmacy really helps as well.
Mm. And I guess when you were saying about being able to see everything from all different aspects as well, because you've had experience in that, I think that's such a vital thing to be able to do, and also a very unique experience that you've been able to see, because actually, like you said, it's made you a better community pharmacist, and it's made you be able to care for your patients better as well by being involved in all these different roles. And again, I could honestly listen to you for hours and just your experiences, and because I think you have so much experience and you have so much knowledge as well, and it's so nice that through roles such as, when you were a CPPE tutor, and even in your role as a pharmacist within your pharmacy team, the knowledge that you can then pass on to others. I mean, I'm learning from you right now as well, to whoever's watching this as well, the nuggets of information that they can take from you and actually then use and implement in their life, I'm sure they'll be very grateful for. So, I mean, I can't stress it enough how much I'm just grateful that you've been able to take the time out today to come and speak to me on here, because like I said, I know you're so busy, but also just going back to, all the work that you've done during COVID as well, on like behalf of the country, like thank you so much to everything that you've done, everything that your pharmacy team has done, and that goes to all community pharmacy teams. And I think that's why, I mean, I'll probably always be a little bit biased towards community pharmacy because that's where I've started off as well. But I do think it is such a special and unique role, and unique job that there is. And there's that phrase that I know I've heard quite a few times, especially during this pandemic, which is not all superheroes wear capes. And I think that is so prevalent for pharmacists and for pharmacy teams. And just thank you again so much. And thank you for your time again today.
Thank you. You're going to make me cry now. It's been a long emotional day, and that's all I need. You know what? I think every pharmacy team out there deserves thanks. Like you said, I think we've all worked really, really hard, and like I said, all of us can go to sleep with a clear conscience and a very kind of open heart, knowing that we've done what we could, knowing that we've done everything we could to support our patients, and we've done that putting ourselves second, putting our patients first, which I'm really proud of the sector too. So yeah, I totally agree with you. Thanks to everyone. And thanks for inviting me. I really enjoyed it. I could talk for hours with you, so we'll have to do another session sometime.
Yeah, no, definitely. That would be so amazing too. We'll get you in. I'll get it in your diary now, because I know.
Okay. I'll get it in the diary now. Okay.
Oh, well, thank you again, Reena, so much.
You're welcome.
I also love the fact that our names rhyme as well.
I know. I was just thinking that, and my kids are ever so jealous because I said I'm being interviewed by a pharmacy YouTuber, and my kids are really into watching YouTubers. So like, wow, how many subscribers does she have? They were like really interested to know all about you.
Oh, bless them. No, I love the Pokemon analogy that you've taken from them. It's I mean, they're destined to just become amazing people because they've got such an amazing role model like yourself.
Oh, thank you. That's so kind. So kind.
Of course. Thank you again, and take care.
Bye.
Bye.